Welcome back to Vet Care. Today, we are discussing Feline Calicivirus, FCV. It is a highly contagious viral disease of cats that primarily affects the respiratory system and the oral cavity. Most infections are mild, but some strains can cause severe, life-threatening illness. FCV is especially common in shelters and multi-cat households, with young cats being the most affected. Importantly, this virus poses no risk to humans. Feline Calicivirus belongs to the Caliciviridae family. There are many different strains, and the virus mutates rapidly. Because of this, vaccination cannot completely prevent infection, but it significantly reduces disease severity. FCV preferentially infects the oral mucosa and the respiratory tract, including the nose, throat, and sometimes the lungs. Rare strains of calicivirus cause virulent systemic disease, known as FCV-VSD, which can lead to widespread organ damage. Transmission of FCV occurs through direct contact with saliva, nasal discharge, and eye secretions. Indirect transmission is also common through contaminated bowls, litter boxes, cages, and human hands or clothing. The virus can survive in the environment for up to 1 month. Infected cats usually shed the virus for 2 to 3 weeks, but some become long-term carriers and remain infectious even without visible symptoms. After exposure, the incubation period typically ranges from 2 to 14 days. Clinical signs then begin to appear, most often as mild respiratory disease. Common signs include sneezing, nasal congestion, fever, drooling, and painful ulcers on the tongue or inside the mouth. In mild infections, affected cats often become lethargic, lose their appetite, and may develop mild lameness. Usually resolve within 5 to 10 days. While more severe cases can last several weeks. Complications may include secondary bacterial infections, weight loss, abortion in pregnant cats, and chronic gingivitis in some individuals. In rare cases, cats develop virulent systemic FCV. This severe form is characterized by very high fever, swelling of the head and limbs, crusting skin lesions, and hair loss around the nose, eyes, ears, and foot pads. Liver involvement may cause yellow discoloration of the skin and mucous membranes. Bleeding can occur in the skin and gastrointestinal tract. Diagnosis of FCV is usually based on clinical signs, especially during outbreaks in multi-cat environments. Laboratory testing can be performed using swabs from the eyes, nose, or mouth for virus culture or RT-PCR. However, interpretation can be difficult because healthy carrier cats may test positive, and routine tests cannot distinguish mild strains from virulent ones. There is no specific antiviral treatment for feline calicivirus. Management is supportive. Mild cases can often be treated at home by keeping the eyes and nose clean, using steam therapy or saline drops. Administering mucolytics and NSAIDs, and offering soft, strong-smelling food to encourage eating. Severe cases and FCV-VSD require hospitalization, intravenous fluids, antibiotics for secondary infections, and intensive nursing care. Most cats recover, although chronic oral disease may persist in some. Prevention remains the most effective control strategy. Vaccination reduces disease severity and viral shedding. In kittens. First dose, 6 to 8 weeks of age. Boosters, every 3 to 4 weeks until 16 weeks of age. Adult cats, 2 doses, 3 to 4 weeks apart. Then, booster every 3 years, or annually in high-risk settings. Strict hygiene, isolation of infected cats, and proper disinfection with bleach are essential to limit spread. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you never miss an update from Vet Care.